Yes, no.
Okay. Good afternoon, ladies and gentlemen, and welcome to our webinar entitled New Ways Forward, Let Us Act as One. To formally start our webinar, we will begin with the invocation followed by the singing of the national anthem.
Most gracious Lord, we thank you for this opportunity which we all convene in your most holy name. To explore the vast knowledge of the universe you govern and entrust to us. Allow us to become open to the wisdom which you are most abundant and guide our hearts and minds to perceive truth, understanding, and increase love for learning. Be with us on this occasion, Lord. This we ask through Christ our Lord. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang mag-ibig, telas ng sinakanan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, tuyag ka ng magiting, sa manlulupin, di ka pasisigil, sa nagagang tutok sa simoy at sa langit mong pagaw, ay hinatang tulad, awit sa pagkayang minamahal. Ang isang ng matawad mo'y tagumpay na nag-iindig, ang bituin at araw niya kailan ang may di magdidinig. Luman ang araw ng walhagit pagsinta, buhay langit sa piling mo. Ang inigaya ng pagkay mga amin, ang mamatay ng dahil sa'yo.
Lift your head, baby, don't be scared of the things that could go wrong along the way. You'll get by with a smile. You can't win at everything, but you can try. Baby, you don't have to worry, 'cause there ain't no need to hurry. No one ever said that there's an easy way. But don't let it bring you down and turn your face into a frown. You get along with a little prayer and a song, and I'll stay through the bad times, even if I have to tell you every day. We'll get by with a smile. You can never be too happy in this life. In a world where everybody hates a happy ending story, it's a wonder love can make the world go round. But don't let it bring you down and turn your face into a frown. You get along with a little prayer and a song. You'll get by.
Mayong hapon sa tanan. Again, welcome to our webinar entitled New Ways Forward, Let Us All Act as One. I am your host and moderator for this afternoon. I'm Dr. Malu Monteverde of the Davao City Chamber of Commerce. And first, we would like to thank the Department of Tourism for allowing us to use the video with a smile video to uplift the spirits of our frontliners and to boost the morale also of everyone in Davao City, especially in these trying times. It has been approximately about 9 months since our city implemented strict measures to combat the ongoing pandemic. We have seen the adverse effects that it has caused on our physical and mental health, including our country's economic state. The city also had extended so much of its resources and given a lot, including the recent inclusions with which the city already asked from us, like the FM Pass, the QR code, no, and many more. Of course, also the massive information dissemination that they have given to the public. But in of this, in the recent days, we have seen a spike of the COVID cases in Davao City. And this is so saddening because at this moment, at this very moment, a lot of our frontliners are are admitted in the different hospitals. And some are even undergoing the so-called cytokine storm. And, you know, it's not that easy. So that today, we are also joined by our esteemed doctors and healthcare workers and frontliners from both the government and the private sector, and even from the national concerned doctors and citizens of the Philippines, who will be providing us the latest updates and their suggestions on other possible modalities to keep us moving despite the uncertainties that this pandemic has faced us with. To know more of this day's webinar, join us as we are broadcast live on Zoom and Facebook. To officially begin, let us all welcome the President of the Davao City Chamber of Commerce and Industry Incorporated, our very own Mr. John Carlo Tria. John?
Good afternoon. Mayong hapon sa tanan, to our guests, fellow trustees and officers of the Davao City Chamber of Commerce, representatives from government, namely the city government and the city health office. Once again, mayong hapon sa tanan. This discussion is definitely timely and relevant. The presentations will help us better understand a long-term way forward. As we all know, that this will not be the only pandemic, this will not be the only disruption. Already we have seen the economic difficulties, and we all know that many businesses are still recovering from the economic impacts of the pandemic. But we still believe that maintaining a good balance between our economic health and physical health is achievable. Nonetheless, 2020 has been a challenging year. As a chamber, we put together a business recovery agenda as early as April to help our local businesses survive and recover. Efforts included an advocacy for banks to extend low-interest loans and restructure current ones, promotion of government financial institution loan programs, and a strong advocacy for the digital economy and better internet. Currently, we have partnered with the Department of Trade and Industry, the Department of Information and Communications Technology, the Department of Science and Technology, and the local academic sectors to create a recovery for business initiative as part of a regional inclusive innovation center. As we will be cascading this over the next few weeks, we hope to encourage more local businesses to contact us with their innovation needs as we put together the necessary package that can help them innovate for the long term. Our online Davao Agri-Trade Expo, which we launched 2 weeks ago, also aims to bring more agribusinesses into the digital economy already valued at $7.5 billion. Our Buy Local campaign will be expanded as we enter the important Christmas season. As we continue to collaborate with the city and national government agencies, foreign and Mindanao chambers, we look forward to help more businesses recover and be resilient for the future. With that, daghang salamat ug maayong hapon sa tanan.
Thank you, President John, for the opening remarks and informing the Davaoenos of what is happening and what has the chamber done to assist also everyone, especially in this pandemic. Okay, our first speaker for this afternoon is a good friend of ours and will represent the City Health Office of Davao. And she is currently the chief of the technical division of the City Health Office. Specifically the epidemiologic surveillance unit and head of the dispensary clinic since 2018. Representing Dr. Joy or Josephine Villafuerte of the City Health Office, and to present new ways of dealing with the pandemic, let's give a warm virtual welcome to Dr. Julinda Acosta. Good afternoon, Dr. Julinda.
Hello, good afternoon all, and we thank you for answering our call or for responding to our call and being our partners in putting a stop, yung COVID natin dito sa Davao City, because we all know that the cases here are rising. So my talk, so I did not know na marami palang attendees na mga doctors, but actually my talk is more on the basics of COVID-19, which we use as our guide in our interventions and responses against putting the stop the transmission of COVID-19. So I'll start my talk on the basics of COVID-19. So I'll start sharing my slides. For a while po. So we all know that SARS-CoV-2 originated in bats. Alam natin yan. And it came really from animals, and it can jump from one species to the other. And this is the third coronavirus to have done so since 2002. And this came from China sometime in 2019. So let's move now to the natural history of the disease. We all know that most of those affected with COVID-19 will manifest as fever, cough, but not all with COVID-19 pakita ng symptoms like lagnat, ubo. Some may just have fatigue, or sa Bisaya pa in our term, kapoy ang lawas, and walang ganang kumain. Some may also show shortness of breathing and other non-specific symptoms like sore throat, masakit maglunok, masakit ang lalamunan, and congestion, headache, diarrhea, nausea, and vomiting. And some may have associated mental and neurological manifestations like anxieties, nervousness, hindi makatulog, merong iba nagpakita na ng mga depressions. So, but there are people who may not have symptoms at all, no? Kaya when we call the case, sabi nila, Doktora, I'm okay, I'm good, wala po akong symptoms. But some also have mild symptoms, like konting ubo lang, konting sipon lang. But there are also cases that will have more serious disease that can lead to death. So in summary, what are the common signs and symptoms of COVID-19? So we have tiredness, muscle pain, kaya may iba nagsabi na, Doc, masakit masyado yung balat ko na kahit a drop of water, it's so painful. No? And what is more specific for COVID-19 is the loss of taste or smell. Sabi nila na, Doc, hindi na started with just a cough or a coryza or kaya sipon, but now, nag-start na ako na hindi na ako makaamoy. So once the patient tells us during our contact tracing na wala na silang amoy, na pangamoy, magsabi kami na sure ball, COVID-19 po talaga. Kasi one-third of the cases will have this manifestation. So the other signs is diarrhea. Akala natin is just a simple acute gastroenteritis or sabihin natin amoebiasis kasi nagmamanifest po sila ng LBM. But some also will say that they have abdominal pain. So the doctors might think that baka gastritis lang ito or peptic ulcer or what, no? Because not all COVID will have these signs and symptoms, and not also those with abdominal pain is COVID. So let's move to the specific and non-specific symptoms of COVID-19. No? Many symptoms are non-specific, which means that they are also present in other illnesses, like just an ordinary flu may show symptoms ng ubo, fever, lagnat. Kaya minsan, mga tao takot nang pumunta sa hospitals or any health facilities, baka sasabihin nila na may COVID na sila because some of the symptoms of COVID are similar to other diseases. But as I've said, there are more specific for COVID-19, like the loss or the ability to taste and smell. These are very uncommon in other infections. So this is just pictures of the healthy and the non-healthy lang, the COVID lang, alam natin. I'm not a clinician, pero bakit nahirapan huminga yung tao? Because titingnan natin yung lang, nagko-collapse, hindi na masyado naka-expand. So let's talk about the incubation period. Kasi itong incubation period, ito yung ginagamit namin as contact tracers na guide namin kung sino ba talaga yung in contact with a COVID case na we can advise that they should go on quarantine or they can have, we can advise them that they should undergo testing. So the incubation period for COVID-19 may be as short as 2 days or maybe as long as 14 days. But 50% on the average will have it on the 5th day. But 95% will have it on the 14th day. Merong iba na matagal yung incubation period nila. And what is infectious period? Ito yung kailan ang tao maka-infect na or maka-transmit na ng virus to other people. So the infectious period will start 2 days before the patient is ill. Up to 10 days during the duration ng illness niya hanggang magre-recover na siya. The end of the infectious period is defined as when it is at least 10 days after the onset of illness, provided that the symptoms are improving and the patient has no fever for the past 3 days. But there are people who are asymptomatic, but they can also be infectious. But the infectious period is more difficult to define. So kailan po ba sila pwede mag-transmit ng infection? We assume that the infectious period for the asymptomatic person is 2 days before the swab, up to 10 days post-swab. So going to the timeline of infection, let's say here that in your company, your manager, for example, was infected on day 0 and he doesn't know where the infection came from. So let's say that on the 14th day, your manager shows signs and symptoms. But as over time, yung sakit niya talagang mag-i-improve lang talaga siya if meron siyang mild illness, let's say about 10 days. And the most infectious period is on day 1 of symptoms. But as I've said previously, that the infectiousness will start 2 days before the start of signs and symptoms. And what are the risk factors? Well, obesity and older age group. Kaya yung mga senior citizen, as much as possible, hindi natin sila pinapalabas. And those with existing medical conditions are also having the risk factors of severity of the disease. Pag meron kang diabetes, meron kang renal problem like you are on dialysis, meron kang hypertension or high blood pressure, liver disease, and those on chemotherapy like mga cancer patients, yung taking immunosuppressive drugs, like mga tao, like mga HIV/AIDS, not taking the regular medications. And this is how the disease can kill because the lack of oxygen can damage the vital organs of the body. How to diagnose that? We have the two kinds of tests. We have the PCR or the molecular test, or sa layman's term na ginagamit natin, the swab test. So the swab test give a sign that the virus is in your cell. Whereas the antibody test, which we are not really doing right now, unlike before na left and right yung ginagamit natin na mga rapid tests, it identified the antibodies to the virus. Usually we use the blood sample. The PCR test is usually done to test those with signs and symptoms, yung mga suspect, yung mga may cough, yung mga merong flu-like illness, and those identified close contacts, pinapaswab po namin. For Davao City, we swab 100% of close contacts. A positive PCR test shows that there are virus particles in the sample. As I've said, there are sometimes false negative results because not all people with infection will have RNA in their sample. And there's no 100% na perfect yung test natin. There are still false negative. I can't move this. Now let's move on transmission. So there are two ways how the virus can be transmitted. We have the first way. The infected people have the virus in their mouths, nose, and throats. That's why we have to use the face mask in order to prevent the spread of transmission, because droplets come out when we are talking, laughing, coughing, and sneezing. And the second way is surfaces may have viruses from someone's respiratory droplets. Kaya we are promoting hand hygiene because virus can survive on surfaces. So this is just a picture of how far a droplet can reach, no? The droplet can travel up to 6 feet. Kaya what we are promoting again is social distancing, along with the face mask, in addition to that, the face shield and hand hygiene. So transmission is more likely with closer contact, like for example, in your offices, in restaurants, in bathroom, in shared environments. And why is stopping transmission so important? Now, let's move to the timeline again of infection. The manager gets infected, and on the 14th day, he manifests signs and symptoms. And this manager infects the secretary. So let's say that the manager is the index case in that office, and the secretary is the first generation. And we call it F1 kasi medyo mataas kasi yung word na generation. Kaya we come up with the F1 or the first generation. The F2 is the second generation, and the F3, the third generation, so on and so forth. Now, what is the window of opportunity? Ito yung window of opportunity na before this infected person becomes infectious. Kaya since this is a very short period, we must act on this period very quickly para hindi po siya makahawa ng ibang tao. Because the incubation period for this F1 is just 5 days. So medyo shorter yung kanyang incubation period. So what we usually do is immediately we isolate this patient before she can infect other people. Reproduction number, so it's just how many people will one person infect, and usually the reproductive number of SARS-CoV-2 is 2 to 3. So even small reproductive numbers create large outbreaks. If each infected person infects just 2 people, the size of the outbreak doubles quickly. Like for example, on this slide, it shows here that this infected person can infect 2 others, and this one. And what happens if we stop each case from infecting just 1 person? Putting a cut or cutting the transmission chain can have big impact on reduction of cases. Because once you immediately isolate or quarantine this person, isolate the case as quickly as possible, then we can cut the transmission chain and we can save a lot of people. Prevention of spread of the disease. How to prevent transmission. One of the intervention is isolation and quarantine, because it can have big impact on reducing the transmission. The stopping one transmission chain can prevent many future cases. So quarantine the close contact can have a big impact on reducing transmission. So let's move now to the definition of the close contact. So a close contact is someone who had contact with a case while they were infectious, during their illness, and 2 days before they are sick. So there are 3 kinds of contact: the physical contact, husband and wife, yung boyfriends, yung physical contact talaga. Yung close contact naman is within 6 feet for at least 15 minutes or more. Yung proximate contact, like in your companies, in your office, nakasama ng isang COVID case for more than 2 hours. Kahit na you will say na meron naman kaming social distancing sa office namin, Doc. Yung mga tables namin is quite far from the other table, more than 2 meters. But because they are in proximity with the others, matatawag pa rin natin sila na close contact because of an extended period of exposure. So ito yung definition ng close contact. At least with a confirmed case in an enclosed environment, in an office, in a clinic, for at least 2 hours. Ito yung suspect natin, yung may mga signs of flu-like or influenza-like illness, may mga sipon, ubo, especially those persons who are senior citizens or who are pregnant or those with other comorbidities. Considered po sila na suspect. Probable case and clustering of cases. It refers to presence of 2 or more cases, either suspect, probable, or confirmed cases. Like for example, sa isang kumpanya, maraming nagkasakit ng flu-like illness, more than 2. So meron po siyang clustering of cases. Or in a company, in an office, in a clinic, in a hospital, meron po kayong kaso na 2 or more cases among health workers, pwede po matawag natin na there is clustering of cases. So isolation and quarantine, these are the interventions that we do. We isolate the case and we quarantine the close contacts. So How long should the contacts stay in quarantine? 14 days po. As long as wala po siyang symptoms during the 14 days quarantine. Treatment, there's no treatment. They have trials on antiviral drugs, but I will not deal on this because I'm not a clinician. Vaccines, we're still waiting for the vaccines. I hope next year, darating na yon. And just a summary of my lecture. Now let's go to the BIDA solution sa COVID-19. So I know that we are encouraging our partners to be part on this and be a BIDA. So the BIDA solution sa COVID-19 campaign will encourage the change in behavior and mindset among the target audience as we go into the post-quarantine and adopt a new normal. So ito yung intended namin na audience. Ito yung the lower D and the E class. Sa atin ngayon, kasi mga A class po ating participants, but still, we are encouraging that you also implement the BIDA solution in your own companies. So ito yung challenge natin. That's why our mayor in the task force COVID-19 in Davao City came up with some measures, mitigating measures, in order to halt the transmission of COVID in Davao City. That despite the deluge of information about COVID-19, many Filipinos still do not comply the minimum health standards. So why? For many Filipinos, surviving hunger is more important than surviving COVID-19. Kailangan nila mabuhay eh. Kailangan nilang kumain. Kaya minsan, hindi na po sila sumusunod sa mga aming mga advice, mga health protocols. So, how the behavior impact our fight against COVID-19? People may not realize it, but their everyday actions make things worse. Nagiging bahagi sila ng problema. By not wearing masks and not practicing the physical distancing and proper hand washing, people unwittingly spread the virus to their loved ones and to their community. Hindi kasi nila alam siguro na ang virus, pag wala yung host, mamamatay lang talaga yan siya. What I mean is, once na hindi yan siya matransmit sa other people, talagang mamatay lang talaga ang virus. So yun lang ang ating gagawin na sana hindi transmit yung COVID-19 virus sa other people para talagang mawala na yung virus. So, what do you want to tell them? Be part of the solution, not the problem. So, the campaign Be the Solution sa COVID-19 ay ito, bawal walay mask in dialect. Sanitize ang mga kamot. Hugasan permanente, or we can use disinfectant like 60 to 70% alcohol. Importante talaga yung distansya sa at least isang kametro. And we should act based on the truth information, yung tinuod nga impormasyon. Mo ni among gipadangat sa mga tao, sa community, with the help of the barangay officials, na dapat maintindihan yun nila because these are just the minimum standards na dako kayo og tabang na para ma-stop ang transmission ng COVID-19 here in Davao City. So ito yung aming mga info materials na binibigay namin para maintindihan ng mga tao. How important are the safety protocol para hindi sila mahawaan ng COVID-19. So our vision is to reach every Filipino. So we would like to partners with other government offices, the private companies, private stakeholders, hospitals, schools, universities, and others. So these are the strategies to halt COVID-19. So ito yung ginagamit namin na cornerstone sa pag-stop ng transmission, detect the case, isolate the case, and treat. And in the absence of vaccine, we use the non-pharmaceutical interventions, like mga preventive measures, the safety protocol, which is the backbone of response to the COVID-19 outbreak. And of course, the behavior change of people. This is the campaign, the BIDA Solutions of COVID-19, communication campaign on prevention of COVID-19. So we should be BIDA Bastonera and BIDA Bastonero. So what are the responsibilities? Adherence to infection and prevention control measures, inform and notify all staff and employees in your companies of the BIDA Solution campaign and the infection prevention and control measures. So ito lang po, sa kampanya ng mga offices, company, you should designate 1 or 2 to be your bastonera and bastonero para makorek po yung mga workers natin who are not adhering to the strict new normal health standards. So appoint BIDA bastonero in your office, in your agency, and the role is 4 P's, pagbigay alam, pagpapaalala, kasi there are times na makalimot jud o taod na pod sa mask. Minsan, during lunch break or snack break, kasama sila sa pantries, nagkumakain na walang mask. Minsan, sige, sa Bisaya pa, sige tabi, sige istorya, not realizing na maybe ang kasama niya is potentially infected. So ensure the minimum infection prevention control measures that it should be practiced in your offices, in your companies, every time and all the time. So Barangay Bastonera, Bastonero serve as gatekeepers of information on health, specifically COVID-19 related advocacies. Provide constant reminder on preventive measures on COVID-19. Bastonero, Bastonera may compose the following in a barangay, barangay kagawad, tanod, barangay health workers, SK chairman. In your office, you can designate your employees. So ito yung aming mga IEC materials na binibigay. So recommendation for LGUs and other stakeholders to adopt the communication campaign aiming to change the behavior among the general public to stop the transmission of COVID-19. And I hope the City Chamber of Commerce can help us on this. So, BIDA Bastonero, you can include this in your protocol, in your office protocol, in your microplan, and ensure that identified BIDA Bastonero will strictly observe the IPC measures and will do the 4 P's because he, she cares. Be part and let us all be the solution. So my references are COVID-19 contact tracing at Johns Hopkins University, Bloomberg by Coursera, Department of Health guidelines, zoning containment strategy from the National Task Force COVID-19. So daghang kaayong salamat. I hope my lecture can help you and can help us also in our fight against COVID-19. Maraming salamat po.
Thank you, Dr. Jolinda. At this juncture, we have noted that the government has really done a lot also, no? Pero dito sa Davao, ang ginagawa natin since yesterday, remember ha, aside from the face shield, face mask, If you're not going to wear a face mask, meron na tayong penalty of 500 pesos. No? And then, of course, our QR code and our FM passes are going to be implemented starting next week. So be very, very sure that you have this, no? Ready for all establishments and for all individuals. Okay, since we have heard already the government, I think it's high time also from the private sector do our share. The government has done a lot, but we noticed also dito sa atin, deeply affected even from the business down to the households. No? So ang daming apektado talaga. So for this afternoon, we would like to remind and inform you that there are several strategies on how to work with together. But the strategies that we will be discussing, as was given by the government sector, and now we were going to have from the private naman, the ultimate goal talaga is the same. And that is to save lives, no? To protect the frontliners, and of course, be able to go back to a new normal. Okay? So for this afternoon, our second speaker is trained in complementary and integrative medicine. His interest in complementary therapies began when he was practicing as a conventional geriatrician in 1998. Bata pa ito. He would see old patients with a list of over 20 medications, and half of which were to negate or to counteract the side effects of the main medicines. This made him continue his research on alternative medicine. He began researching ways of treating diseases without using conventional medicines. Here to give and present to us other acceptable medical modalities in relation to COVID-19, let's all welcome Dr. Homer Lim. Good afternoon, Dr. Homer. Dr. Homer. We're just waiting for Dr. Homer. We will be, while we are waiting, we'll just remind everyone that these are new modalities or new interventions that most probably can help us also, but it will be definitely up to you whether you're going to use this or not, or to adopt this. But the ultimate goal and things that we should do is save lives, protect the frontliners, and be back to a new normal. Okay. Dr. Homer, are you in? Oh. Okay, so
Hi,
now we have
sorry.
Dr. Homer. Okay.
Sorry.
Welcome back,
Okay.
Dr. Homer. Okay, it's your turn now.
Sorry.
Okay.
Okay.
Please go ahead.
Okay. So here, okay. Thank you, Dr. Malu, and thank you everyone for inviting me. So before I begin, like just to make a disclaimer, I do not own, manufacture, or distribute any of the drugs that we will be discussing today. Okay. So thank you. So our advocacy is actually called Flatten the Fear. It's an awareness campaign about doing prophylaxis as well as early treatment for COVID-19. Okay. So why are we doing this? Because of course, everybody knows we are suffering now. Okay, because of these lockdowns, it's not only COVID-19 that is affected. All patients, whether they have diabetes, cancer, heart disease, tuberculosis, okay, so the number of deaths will not change whether or not we have COVID or not. So we have to find other ways, other new modalities in how to combat, okay, our problems with COVID. Okay, so it's really our economy. GDP declined by 9%. We are a consumer economy. Therefore, if we do lockdowns, and we are not able to transition out of a lockdown, then we will have problems. Our economy will deteriorate even faster. So even Dr. John Ioannidis, who is probably the most cited author, most cited meaning all his papers are cited by many other scientific journals or scientific articles. So even he said it's so that lockdowns are not the solution because the consequences of the lockdowns will be far worse than the COVID. Okay, so our objectives for our Flatten the Fear movement is to prevent hospitalization and death. Okay, number two, how do we prevent? We treat early. Okay, if we treat early, then we avoid hospitalization. We avoid people from dying. Okay, give people the right information how to boost the immune system. Thereby, this prevents them from being infected. And if they're not infected, then you avoid hospitalization and death. And then lastly, how to ease away from lockdowns. Instead of lockdowns, we do what we call focused isolation. Okay, so this is our prevention protocol. So vitamin C, 2,000 to 3,000 milligrams, vitamin D, 2 to 5,000 units a day, virgin coconut oil, 1 to 2 tablespoons a day, zinc, 10 to 50 milligrams per day, quercetin, 500 milligrams per day, or ECGC, 500 milligrams a day. Okay, so we all know about vitamin C, how effective it is in fighting all forms of virus, not just the cold. Okay, very important thing, I think, what we should be taking, everyone, okay, all Filipinos should be taking vitamin D. Okay, as has been shown by numerous studies, hundreds, if not thousands of studies, that vitamin D affects your immune system, not just your bones. Okay, so they found out that those who had lower vitamin D levels of 30 nanograms per milliliter are at increased risk of an infection. More than that, if you are in the hospital, okay, and you do not take vitamin D, the chances of you going to the ICU is 50%. However, if you do take your vitamin D together with azithromycin or hydroxychloroquine, then your chance of being admitted in the ICU is 2%. So that alone is a very important vitamin D. Okay? So in fact, Dr. Fauci himself admitted that he takes vitamin D supplement. Okay, so even though he does not advocate it, yet he admittedly said that he takes vitamin D. I'm sorry. Okay, so zinc is important because it blocks the coronavirus from replicating inside the cell. Okay, however, zinc needs to enter into the cell without it becoming without the zinc going inside the cell or penetrating the cell, it will not be effective. So how do we make the zinc go inside the cell? We need a gun. Okay, so our analogy would be the chloroquine, hydroxychloroquine, quercetin, or ECGC acts as the gun. It opens the gate for the zinc to enter the cell. So zinc has to enter, but you need a gun or somebody to open the gates for them, and that's your hydroxychloroquine, quercetin, or ECGC. So we also know, especially the pediatricians, they do give zinc in patients who have viral diarrhea. And not only that, zinc is actually a very good antiviral medication, not just for diarrhea, but also for respiratory illnesses. Okay. Okay. Then this is quercetin. Quercetin is you might have heard this just today. Actually, quercetin is a component of phytonutrient that is found in all your onions, your garlic, okay? Talbos ng kamote have high amounts of quercetin. So quercetin, like zinc, inhibits viral entry, inhibits virus from assembling inside the cell, inhibits RNA polymerase, DNA polymerase, as well as the reverse transcriptase, and is a very good immune modulator. As you could see, for mild cases and prophylaxis, you just need 150 milligrams or 500 milligrams twice a day. Okay, hydroxychloroquine. So we're gonna discuss something that is has been very controversial, even though it's not supposed to be. Okay, Dr. Harvey Risch, an award-winning Yale epidemiologist, said it himself because he made a meta-analysis of hydroxychloroquine. When we say meta-analysis, is they compiled all the different studies on a certain topic. So hydroxychloroquine meta-analysis was done by Dr. Harvey Risch. So he even said it, it's been highly politicized, okay? So what we advocate is early treatment of COVID, okay? So this is the estimated number of people who have lost their lives because of the incorrect hydroxychloroquine or HCQ advice, okay? So what's the reason why we need to treat early, okay? We need to treat early because we want them to catch them as early as possible. If you see from day 0 to day 7, that's your viral replication. From this point on, 0 to 7 days, you already try to treat to decrease your viral load in your blood. The more viral load in the blood, then the more cytokine storm, the more problems you have. So it's best to treat within the first few days of symptoms, even few hours. Once you have symptoms, you treat immediately. That's the main point, and that is the rationale why we need to why do we need to treat COVID as early as possible. Okay, so even Dr. Fauci himself said a few days ago, he said, we need something to treat early COVID because 20%, so he said it himself, 20% of symptomatic patients will progress to severe or critical disease. So remember that if you have 20% of symptomatic patients becoming severe, then you're going to be congesting the hospital. So how do you decongest the hospitals? How do you prevent them from going to the hospital? You treat them early, okay? So if you treat them early, based on the studies of 137 trials, if you treat them early, okay, you reduce hospitalization or death by 63%. 63%. This is not an approximation. This is based on 137 studies. So if you can reduce 63% of reduction or 63% reduction of hospitalization or death, then you're going to be able to decongest the hospital. You'll be able to decongest the number of beds, the ICU beds in your hospitals. Okay, so this is another graphic showing you the benefit of doing a early treatment. Okay, so I want to reiterate that early treatment. Almost all the studies on hydroxychloroquine has been when the patients are hospitalized. We want to treat them early, even before they become hospitalized, okay? So in many countries, China, India, South Korea, Costa Rica, UAE, Turkey uses HCQ for early treatment and prophylaxis of COVID-19. In fact, South Korea, only 388 deaths. Why? Because they either use Kaletra or hydroxychloroquine when they have the symptoms. They don't even wait them to become sick. Sick to the point of going to the hospital. You treat them as early as possible. So what's the problem? Why there's so much negative feedback with hydroxychloroquine? Because they say it can cause heart rhythm problems, right? Why is this? Because the dose was too high. Okay, the dose given in the big trials, the one in World Health Organizations, were from 1,800 to 2,500 milligrams. However, the recommended dose is just 400 milligrams a day. So you could see again the difference. Why the studies on hydroxychloroquine by WHO, the Solidarity trial, the Recovery trial, all failed because it's too high. Of course, you will develop rhythm problems. Okay, but at 400 milligrams, you won't have that problem. Okay. Now, another issue that we want to make you aware is World Health Organization. Okay, for patients who have mild or moderate symptoms, they don't even suggest you taking antivirals or antibacterials. Okay, so which is what we don't want. We do not wait for them to become sick. Okay, US NIH guidelines, same thing. If you have mild symptoms, okay, even though you have high risk factors for having a severe COVID illness, no treatment, okay? In the Philippines, we followed WHO guidelines, which is only supportive treatment, no active antiviral or antibacterial treatment. However, as what Dr. Peter McCullough, as well as together with Dr. Harvey Risch and multi-center trial on the early outpatient COVID-19 treatment. Okay, so again, it's early and it's outpatient. You do this outpatient. You don't wait for them to be hospitalized. You treat them as outpatients. Okay, in fact, in Greece, you could see there, if they have already comorbidities, whether they're 50 years old or more, they have comorbidities as what we discussed earlier, hypertension, obesity, diabetes, heart disease, and all of this. If they have that, treat them. Even you can see here, they already started treatment at home. Bangladesh, same thing. They even give prophylaxis to close contacts, household contacts, or caregiver to the COVID positive patients. India, same thing. India made it a national protocol wherein patients with mild, okay, and they have comorbidity or they're more than 50 or 60 years old, treat them immediately with hydroxychloroquine. So when we say early treatment, you treat immediately with the appearance of symptoms. Do not wait for the test results, because sometimes the test results would come 3 or 4 days after, then you already lost the window of opportunity. So you treat them as early. The moment they see you, they're more than 50, or they have diabetes, hypertension, obesity, they have lung issues, kidney problem, you give treatment already. Do not wait. Okay, so treatment early treatment will decrease your hospitalization and mortality of up to 90%. Okay, so the treatment will always include an antiviral and an antibacterial drugs, as well as vitamins and phytonutrients. Okay, so again, early treatment, we offer this to those over 50 with or without comorbidities, and all ages with at least one comorbidity. Okay, so this is the algorithm made by Dr. McCullough. It's very easy to follow. As you could see, what we advocate is also what is in this algorithm. Okay, again, the early treatment protocol based on Dr. McCullough is either you give hydroxychloroquine and then azithromycin or doxycycline. If you are averse to hydroxychloroquine, then you can use ivermectin, 6 to 12 milligrams for 1 up to 3 days only, together with azithromycin or doxycycline. In addition to that, we give their vitamin C, their vitamin D, as well as zinc. Okay, so you can see here, in other countries, they even have their own kits, home kits. They send patients home. Okay, send patients home when they have mild symptoms. They send them home, give them the kit. Okay, here in the Philippines, we also have this Ted Locsin, a native of Bacolod. He made this packs. So we have pack A, pack B, pack C. It depends. You have 3 days, 5 days. You have 7-day treatments, either ivermectin or hydroxychloroquine. Okay, so we have people who are actually aware of what's happening also in other countries. So with regards to safety of hydroxychloroquine, okay, this study was done by the European College of Society of Cardiology. This was published as early as July, and you could see even in patients, whether they're at home or in hospital setting, they said hydroxychloroquine administration at 400 milligrams per day, safe, short-term, can be used in COVID-19 patients in all settings, whether it's home or hospital. Okay, ivermectin safety. How safe is ivermectin? You could see here, 170 infants, okay, and children ages from 1 to 64 months. Okay, if they were given a dose of 223, a mean dose of 223 micrograms per kilogram per day, adverse effects very minimal, only 4%. So if this is safe in children and infants, why not in adults, right? So ivermectin actually is a very good safety record if you are averse to hydroxychloroquine. Again, These are what the trials now in registered with the clinical trials of the U.S. National Library of Medicine. You could see 41 studies for ivermectin. You have 220 studies for hydroxychloroquine and 41 studies for ivermectin. Okay, so there is now an active uh, randomized control trials for both these drugs. Okay, so aside from early treatment, what do we suggest to mitigate the spread of COVID? This is based on what China did. This is we just kind of put it together based on how China and other countries were able to control the spread of COVID. Number one is to set up fever clinics. Okay, instead of patients crowding your ER, crowding your hospitals, set up fever clinics. Make barangay health centers your first line of triage. Okay, so all patients with symptoms related to COVID, okay, or any flu-like symptoms, seek consult at the regular or at the local health unit or the barangay health center. Test for COVID. In the meantime, while waiting results, the healthcare worker or the doctor, preferably your GP or your family med doctor, will assess already if patient is for home quarantine or they need to be hospitalized. If they are going to be for home quarantine, then you check, do they need to take drugs or not? If they are over 50, okay, or they have comorbidities, you give them the medicine already. However, if they do deteriorate, then that's the time you transfer them to the hospital. However, if their symptoms are mild, please do not put them in the hospital because you need those hospital beds, you need those ICU beds for patients who really need them. And mild patients do not need to be hospitalized. They need to be monitored, but they do not need to be hospitalized. That's very, very important. I think one of the mistakes that we did here in Manila was in the beginning, they were admitting even asymptomatics, they were admitting asymptomatic. Do not do that. Only admit those who have moderate or severe COVID infection. So for home or isolation facility, patients and all members. So when you have a positive patient for COVID, okay, or they're awaiting them for their test, right? You isolate not only the patient, include also all the household members. So you quarantine the whole household, not just the person or the patient, because it does not make sense. If you want to quarantine, you have to isolate the whole household because your thinking is most likely they are also infected. Okay, so you quarantine them for at least 14 days. The local health worker or the barangay rapid health unit monitor them every day or at least 12 hours. Check for symptoms, vital signs. Okay, always include your oxygen saturation. So I would suggest if you're going to put them on home isolation, especially those who are over 50 already or they have comorbidity, get a pulse oximeter. Get a pulse oximeter. Not only get a pulse oximeter, put oxygen tank on standby. Put oxygen tank on standby. Why? Because in my experience, those patients with comorbidities or those above 50, sometimes they start coughing and then they have difficulty breathing. They start panicking, then they want to be sent to the hospital. Okay. However, if you have oxygen ready, then they will be more at ease. They won't be afraid because they know they have oxygen. So you do not crowd the hospital. You give the treatment, you give the hospital some form of relief, okay, by making sure we treat early, we prevent patients from being mild to becoming a severe COVID infection, okay? So once they're asymptomatic, you can stop your antivirals and antibacterials. However, if they notice you have deterioration of vital signs, your oxygen saturation goes below 90, even though your oxygen is already full, then you have to transfer them to the hospital. So we don't crowd the hospital with mild and asymptomatic. We put in those who really need them. Okay? In Manila, there was a time wherein literally you could not admit patients. Even though they're already oxygen is less than 90, despite being on 10 liters of oxygen. Their oxygen level is less than 90. You cannot find a bed, a hospital bed or an ICU bed because we're all full. Okay, so this is our experience here in Manila. You treat them early. I've treated over 200 patients. I can tell you, I've only one patient who was admitted to the hospital because by the time I was informed the patient was already having difficulty of breathing. I had 94, 60, 70, 80, 90
No,
4-year-old is my oldest patient. So it's very, very important to do that. Okay. Okay. So in barangay so what else do you do to mitigate the spread? In barangays or areas with more than 50 cases per 100,000 residents. Okay. So when we do institute some intervention, it has to be data driven. It has to be based on data, not based on opinion. It should not be based on fear. It should be based on data. So if you have more than 50 new cases for every 100,000 residents for the last 7 days, then you isolate the barangay. You don't isolate the whole city. You either isolate the whole barangay, the whole compound, the house, not the whole city. Okay? And then next, you treat or you test one member of each household of the barangay. If any one of those, if the test comes out positive, then you either test the whole household or just isolate them. Okay? Most of the time, remember, 96% are mild or asymptomatic. Okay? So if you test one member, it's positive, you choose. Do you want to test all of them or just isolate them for 14 days? Okay? And just monitor them. Okay? Of course, if we want to do this form of isolation, make sure that we have enough food, medicine in the barangay for that particular isolation. Okay. Now in business zone, factories and ports, very, very important. We keep on forgetting no communal eating, chatting, or socializing. And in high-risk individuals, okay, we do provide prophylaxis. Okay. So prophylaxis is vitamin C, D, zinc, quercetin, or ivermectin or hydroxychloroquine. It's really up to the health department what they decide to do. Okay. Now contact tracing, as I know already, Davao has its own contact tracing app. We would want to see a national, not just a citywide. I would say a national because it becomes easier to manage instead of going from one app to another app from different cities. I think that doesn't make really a good, good model. Okay. Now, we would suggest to use artificial intelligence in contact tracing, rather sending those contact tracers out into the barangays, out into the city, because contact tracers can be a source of COVID spread. Okay, and of course, the last very important is we need to make sure that the public knows what's happening, knows our plans. How do we ease lockdown? How do we address the increase in numbers of infections? What would be our medium-term, long-term plans? I think this is one reason why a lot of people in the public are very they have COVID fatigue, right? There's such a word as COVID fatigue. They're just tired about COVID because they just want to earn their own living, right? So prophylaxis, again, vitamin C, vitamin D, zinc, quercetin, BCO, okay? For those who are really in high risk, frontliners, your security guards, your doctors, your nurses, they can choose whether they want to take hydroxychloroquine or ivermectin. Okay, so that's the end of my lecture because I only have 20 minutes. Thank you everyone for listening.
Okay. Thank you, Dr. Homer, for a very interesting presentation. Hopefully we can, get some insights on how we can have this used in our practice, and also how to disseminate this to our not only the household, family, and friends, no, to protect ourselves. But from what Dr. Homer just mentioned, parang the basics yata talaga, Dr. Homer, is vitamin C, zinc, vitamin D. Is that right?
Yes, that's
Yeah.
right. Vitamin C, zinc, and quercetin. You have to have either quercetin or ECGC.
Okay. So those are
ECGC
the,
is from green tea. Yes.
okay, parang yun ang pang araw-araw talaga na protection na kailangan natin,
Yes.
right? Okay, and then
Yes,
we use the others pagka medyo symptomatic na, then that's the time you use the second, yung mga hydrochloroquine or the ivermectin, or Dr. Homer, you've mentioned also regarding lingua, but later on we'll talk about it during the open forum. So prepare your questions. We're going to have an interactive open forum later, but please respect lang the interactions that we're going to have. And of course, if you can, send in your questions so that we can entertain you later. So at this juncture, we encourage our audience members to send in your questions to our chat box. And we will have an open forum after the reactors panel. No? In the meantime, please do watch this first. Okay.
Tingnan mo iyong palad, kalyado mong kamay sa hirap ng buhay. Ang dami mong problema na kung pangiti, no'y pikang nga astig. Saan ka man naroroon, huwag kang matatakot sa barilong patalim, sa bakas ng madilim. Isip kong dagat, nalibot kong mundo, nasa puso ko pala ang hinahanap kong kulo. Ilang beses na akong muntikang mamatay, alam ko ang sekreto kaya't nandito pa at buhay.
Amazing number of Filipinos work in our NHS, helping everybody. So thank you to all the Filipinos doing all this amazing work.
There is only one thing we say to the god of death, not today. Huwag po kayo susuko, bayani po kayong lahat.
Sabi nila may anting-anting ako, pero di nila alam na ang Diyos ang dahilan ko. Hoy, Pinoy ako, buo aking loob, may agimar ang dugo ko. Hoy, Pinoy ako, may agimar ang dugo ko.
Thank you. Thank you for honoring our medical frontliners. We thank also the Davao City Chamber of Commerce for giving us this opportunity for the medical group and the healthcare workers to air their side, especially from the private sector. At this juncture, we are now on the second part of the program for this afternoon, so that we are joined this afternoon by distinguished speakers and panelist reactors in their various field of expertise. So let's start with Dr. Ronald Tanhente, who's the medical director of Davao Doctors Hospital, to give a reaction to the presentations and of course the present situation that we are in here in Davao City. Dr. Ronald, please. Thank you.
It's actually an honor to be invited here. In fact, Dr. Homer Lim's lecture was actually very interesting. For your information, Dr. Lim, I've been taking all of this vitamin D, vitamin C, zinc, including quercetin. My wife is actually an advocate of this, and except for hydrochloroquine though. But I think it makes sense. I think it also makes sense when you talk about trying to address the prevention side or the prophylaxis side, as we call it in the medical field. Now, I have to put this in a proper perspective. Dr. Lim's perspective is actually non-hospital based, which is actually also another form of trying to address COVID in this particular scenario. In a way, Dr. Acosta has another different perspective, which is the City Health Office in addressing the issues in the whole of the city. And then Dr. Malu and this Davao Business Club, Davao Chamber of Commerce also has their own perspective, because you're actually looking at jobs and businesses. However, on my end, being part of a tertiary hospital, we also have another perspective. In a way, I appreciated the lecture of Dr. Lim because he tried to address lowering the hospitalization of this particular patient. So basically, what is happening now in our hospital, initially, as a matter of policy, because I am part of directly involved in the strategic planning in the hospital, looking at the medical as well as the financial profitability side of Davao Doctors Hospital. As much as possible, we don't want to admit COVID patients. In fact, if you talk about revenues per se, our revenues come primarily from our high-value surgeries, and then, of course, medicines and other oncologic services and some other things. So in other words, we would try to address the misconception that hospitals are actually taking advantage of this scenario, where in fact, even Davao Doctors per se is financially struggling. So it's not totally true. Doctors are also not making money out of this. However, because of our social responsibility, we have to take care of our patients. In fact, we have a lot of patients coming in the last 2 weeks. Very, very difficult. And Dr. Lim was saying that in Manila, the waiting period for patients to be admitted is quite long. And in Davao, at the last 4 days, we refuse patients anymore because we cannot take in COVID patients because it's our COVID ward in the main hospital is actually full. So that is a big problem. So I think the point of trying to isolate the barangay level is very, very fair. There is a clamor for us in the medical side in Davao City to go into maybe an ECQ level, to say the least. But the thing here is that my own point of view, as well as the point of view of some of the medical directors of the private hospitals in Davao City, we think as far as our knowledge, because we don't just consider the medical side, we also think of other social factors, even the financial side of it. We think as the citywide hard lockdown is not really a very good strategy because it will hurt people the most, because we have other members of our society who are, daily wage earners that are really hard up at this point in time. So I agree with the strategy of the city government in trying to address this by doing a barangay level lockdown. The other thing is that we also have to address issues in relation to this particular crisis. Actually, the past few months, Davao is actually doing very well. And it was stated in the UP COVID-19 modeling system that Davao will have its peak in November and will plateau down to December. So on the Davao doctor side, we are actually prepared and assumed that's going to happen, and it came. And so we had to prepare on our end. We had to do some retrofitting in our wards. We had to look into logistics, supply, manpower, training protocols, because we anticipated that this is going to happen. I think at the end of October, SPMC's capacity is already full, and so we had a very hard time transferring our patients to SPMC. In fact, the last 2 weeks, we were not able to transfer patients anymore, unfortunately, because SPMC is full. And what we also have right now is we have our gene expert, because we can now be able to get our results, RT-PCR results, within a matter of 2 to 3 hours. So we have our own in-house RT-PCR machine. And so in terms of trying to make our cohorting and trying to where to position our patients, it is actually a lot better. Now, in other words, I think on the point of view on the macro level, as far as the city is concerned, we have to improve our health capacity. I understand SPMC is having a very difficult time, but then if they can push further and expand further, that is going to be good for the city. However, on the part of the private sector, the good thing is we are talking and then we are helping with the government, and we are trying to improve our health capacity as well. Another thing that we need to improve on, as far as my perspective is concerned, is the misinformation. We should not underestimate COVID. The national mortality rate is around 1.8%. It's quite low as compared to some other countries in the world. In a way, we are seemingly successful in terms of trying to lower the mortality rate. However, in Davao City, the mortality rate is 5.2 to 5.3%. So, in other words, if you think about a 2 million population in Davao and just focus on the 5.2%, 104 people will die in Davao City. So in other words, if we don't address this as a city, as a team, meaning LGU, private sector, public sector, it's going to be very, very difficult, especially on our perspective, wherein they come in very, very sick. And so that is very, very difficult. And I think what is also very important is we have to eliminate the seemingly vested interest in relation to decision-making process, because it makes matters really worse. So in other words, we have to try to be altruistic in trying to deal with this very difficult situation. We really have to be honest with each other. Likewise, deal with this accordingly. And lastly, we have to be very consistent. I know the policies keep on changing, because everything is fluid. Even the treatment process is also very fluid. And so it's very difficult to say whether this is the best treatment. At the end of the day, on our end, on our own perspective in the healthcare industry, in the private hospital setting, we are doing our best to help the community, pushing our doctors, our nurses, our orderlies, even our financial resources, logistics. History will judge us. But at the end of the day, we are all humans, and whether you're a doctor, whether you're an engineer, a business person, we all need to work together to address this big problem. Thank you very much, and keep safe, everyone. Thank you.
Thank you.
Dr. Malik, after you.
Yeah, thank you, Dr. Ronald, for really saying what's the true status of Davao doctors and also the private hospitals now. Kasi ang akala talaga ng marami, okay pa rin ang Davao City, no, when it comes to the private hospitals. And then we all know also that there's a difficulty, especially for non-COVID emergencies, to go to the private hospitals because yun nga, priority talaga is you need to be screened for COVID. So RT-PCR is needed before you get to be admitted. So that's something else, and it adds up to the cost of the hospitalization of the patients, no? So, and a lot of misconceptions have come out in the social media about who doctors are, what are their intentions, and also with the government. Probably they mix this up with the PhilHealth issue. No, so I hope this gets to be clarified also, and we can really work together because this issue is not just about the government taking control of what, but it needs to be a kumbaga, multi-stakeholder approach on how to deal with this pandemic and the effects. No?
Can I make another comment, Dr. Maludia? Just a very
sure.
I think you should also try as a non-medical side. The call of the doctors of trying to take a break is not really literally that we are tired. The point here is that we wanted to lower the number of cases because the waiting time is very long. We wanted to bring down the cases so we have more beds and so we can accommodate more patients coming in. And that is the bottom part of everything. It's nothing, we are tired, but it's okay.
Okay, Dr. Ronald, if I, correct me if I'm wrong, at this very moment, Davao Doctors Hospital is already full capacity. Is that right? Puno ang Davao Doctors in terms of beds, sa number of beds.
Okay, I will put this in a proper perspective. I am very much involved in the decision making. In fact, I do most of the decision making in the hospital. We have two centers. We have Dumoy Satellite, and we have our main facility. Dumoy Satellite takes care of mild cases. In other words, in Davao Doctors, not really a big hospital per se. We are addressing two teams to cater to Dumoy Satellite and likewise cater to our main hospital. In our hospital, to be honest, we have prepared we have retrofitted our wards, physically, negative pressure and everything. We have a nice protocol. The problem is the patients keep on coming. And what is the situation now? Initially, Davao Doctors Hospital, we have our COVID wards in a private suite, in a presidential suite room, in our suite room. So a very nice room, bigger rooms in particular. Because the patients are still coming, right now, I am forced to decide to put 2 beds in one private room. I cannot allow our patients to stay in the hallways or stay longer in the ER. But despite that, a lot of patients are still waiting in the ER. And the scenario is, unfortunately, in this particular stage, we cannot treat all of them. Unfortunately, those who died are those with comorbidities. And so in a way, you have to balance everything out. A scenario wherein it's very difficult whether you have to choose patient A and patient B. And that is the situation now in Davao Doctors. So it's really very difficult.
Mukhang mahirap yan, Doc, no? Because you really have to choose who to admit. But at this point, your hands are full and you cannot even choose. You don't have the option to who to choose, no? And before, we all know, Dr. Ronald, that you're going to leave after this this talk because you have a meeting with, is that right, DOH and the regional IATF, then DILG for the Private Hospitals Association. So there's a question kasi for you, no? It's like this. if, as Dr. Tanhente says, the national mortality rate is 1.8%, why is it that 5% plus is in Davao City? This is very worrisome for us Davaoenos. This is from Ismael Tabihe. Yes.
Yeah, that is a very, very, very good observation. So you're listening to my talk. So it's very true. I think it is something to do with SPMC being overwhelmed already. In fact, if you look at the numbers, I'm very analytical in terms of the decision-making process. SPMC ICU is only 33 beds. And unfortunately, they cannot expand it, unlike TTMF facilities wherein they can add more facilities. But the thing about ICU is it's fixed at 33, and a lot of patients are waiting to be admitted in SPMC. Because of some of the severity of the cases, some of them unfortunately died while waiting to be admitted in ICU. And so on my part, in the Davao doctors per se, I am telling our wards, our doctors, we have to be better. We have to treat our patients. We have to improve our mortality rate. And then in fact, we have already have remdesivir in Davao doctors. We have looked into going to CRRT, dialysis, and all those arrangements. However, the truth is, the resources are limited: manpower, financial, what sort of. But yes, we will try to improve on the mortality of Davao. We actually certainly play a big role as part of addressing this problem on the private sector. Thank you, Dr. Malik.
Thank you, Dr. Ronald. As we all know naman, 90% of COVID cases are mild and asymptomatic, no? And there's that sector that about 10% moderate to severe, and these are the ones which goes to the hospital. So it's the management per se that for this 10%. But of course, as you've mentioned, medyo malaki yung scope ng ginagawa dapat natin lahat, no? Everybody has its role. Okay. So at this point, before we go to the next reactor, we'd like to thank Dr. Tanhente for joining us. And Doc, pakisabi na lang what you just mentioned here to your meeting with DOH and that of DILG and the RITF. Thank you, Doc Ronald.
Thank you, everybody.
Yeah, thank you. Okay. At this juncture, we're going to proceed with the next panel of reactors. No, so we're going to call on the next reactor, who is the president of the Philippine Nurses Association Davao Chapter. So please help me welcome Miss Christine Aquino. Ma'am Christine. Ma'am, nakamute pa po kayo.
Pleasant good afternoon to everyone. First and foremost, I would like to thank the Davao City Chamber of Commerce and Industry Incorporated for inviting me as one of the reactors in this webinar. With the theme, New Ways Forward, Let Us Act as One. I am also grateful for this opportunity to be here this afternoon, as the nurses are among the frontliners and are at the forefront in the fight against the COVID-19. It has already been 9 months since we are in this fight. No? So our nurses have been already battling and even at risk with the infected with COVID-19. With the first topic of Dr. Acosta, the new ways of dealing with the pandemic, I really appreciated the discussion of Dr. Julinda on the basics of COVID-19, from the signs and symptoms, to its preventions, to the different strategies and solutions. The city government has already done a good job in finding strategies to stop the spread of COVID-19 infection. However, we face a lot of challenges. True, the reality really bites. Most of the Filipinos prioritizes first to fill in their empty stomachs rather than survive the COVID-19. So thus, we can say na marami tayong makikita doon sa daan, hindi nagpa-follow ng even simple protocols of physical distancing, proper use of face masks and shields, and even the basic of hand washing or hand hygiene. our fellow Filipinos has also these misconceptions, and we need to have more information drive so that to correct these misconceptions. Like we can see in the social media, hindi sila talaga naniniwala sa COVID. So plus being tainted with the PHIC the last time na meron tayong mga gawa-gawa lang yung COVID. So the government has to do something about it. And then, in order to change this behavior, I really appreciated the BIDA solution of the DOH. So it must start from different workplaces. Like us in the hospital, meron tayong dapat batonera, yung tagabantay. In SPMC, we had also like this, in which the nurses or any health worker who does not wear mask or face shields got penalized from first offense, second offense, to third, even to the third offense, to suspension. So we need a lot of efforts in this in every workplaces, collaborative actions, even to the LGUs and barangay level, to watch over the people who are non-compliant of the different simple health protocols. Another thing also, as health workers, let us all remember that even we are not treating patients, there is a continuous risk of getting infected of COVID-19. We have a rough estimate of the nurses, we have siguro mga 150 na yung mga nurses who are already recovered from COVID. So let us all stay vigilant and let us protect ourselves from the possible of infection whenever we are, and let us all be safe. On the second topic, I really like the advocacy of Dr. Lim regarding the prevention, early treatment, and these modalities, new modalities. As we all know that SPMC is the sole hospital or the big hospitals treating COVID-19. And we face a lot of burdens of having a full bed, and we face a lot of understaffing also among nurses. So maybe advocating this could decrease the hospital bed occupancy. So he mentioned about the prevention for which vitamin C, zinc. I have been taking these things also as a health worker. Then the quercetin, we can find it in onions, green tea, and even apples. So we should take a lot of this one as a prevention. So it is important to really boost our immunity. So to prevent this COVID-19 from infecting us. Yesterday, I have talked to some colleagues. Looking at the scenario, I am saddened by the full bed occupancy of the hospital. So I was wishing that there should be somewhat advocacy that this should be a household, something like, it should not be some like mild cases, moderate case, except in the very serious cases, should be treated at the outside hospital base. So maybe the advocacy of Dr. Lim is somewhat an answer to what we have discussed yesterday with regards to early prevention and treatment before bringing the patient to the hospital. And tapping the barangay level takes a lot of collaborative actions from the different health sectors. And it does not only affect the city, but also the society as well. So let us work hand in hand, the different organizations, in order to help the city stop and fight COVID-19. Thank you and good afternoon.
Thank you, Ma'am Christine. medyo mahirap talaga ang ginagawa ng mga healthcare workers ngayon sa Davao, and everybody is affected, not only the frontliners, of course, the karaniwang tao, kasi wala ka nang mapuntahan ngayon, no? So we need to really work together hand in hand, as you've mentioned. Thank you, Ma'am Christine. We'll just wait for the rest before we do the open forum. Okay. So for our last reactor, we are joined by the president of the Davao Medical Society, Dr. Jose Beltran, or Dr. Jobel. Dr. Jobel, please.
Maayong hapon, magandang hapon sa lahat. Good afternoon, colleagues, stakeholders, friends. I would like to thank the Chamber for inviting me to show my thoughts on this pandemic problem of ours. It's getting worse. It is an honor for me to be here this afternoon. Now, I would like to think this activity as with optimism rather. Sabi nga nila, there's always a rainbow after a rain. So, ang activity this afternoon is a rainbow, especially the second lecture this afternoon. Now, yung sa first lecture, how I understand is that the government has more of an information campaign, and regarding this problem, they have strategies also, and designation of bastonera and bastonero. I'm wondering if they are giving supplements or vitamins at the barangay level for this, especially zinc, vitamin C, so on and so forth. So hopefully they do. Now, as to the second topic, based on 2018 data, it says that cancer is the second to cardiovascular disease as far as mortality is concerned. It used to be infectious disease. Ngayon, na-overtake na ni cancer sa infectious disease. And there are now recommendations for managing early COVID infections. Now, the problem here is that initially, okay yung SPMC as the dedicated hospital for COVID. No? Walang problema. However, later on, nagkaroon na ng problem kasi napupuno na siya. Meron ngang spillover sa other hospitals, sa private hospitals. No? The reason for this strategy was that there should be no contamination of private hospitals. So SPMC, which is government hospital, caters to all COVID cases. Ang drawback, ang kawawa yung mga financially challenged nating Filipinos na walang-wala. Saan sila tatakbo? Kasi SPMC will not admit them if they are not COVID patients. No? So I've heard before that the city government will take care of these financially challenged patients to private hospital. Meaning to say that the city government will pay all the bills of these patients admitted at private hospitals, non-COVID. I don't know what happened. Then these recommendations for early treatment or early intervention, I see it as a hope. So if we can get hold of these treatment protocols, why don't we ask or recommend this to the LGU? We talk to our mayor and we'll tell our mayor, why don't we do a pilot study and do a clinical trial on high-risk barangays here in Davao. And if it turns out to be successful, then we will publish it and show that this is effective. This is the way to do things, rather than wait and give symptomatic treatment to those asymptomatic or mildly symptomatic patients, which follows the WHO protocol. At least we are doing something while waiting for the results or for the progression of the disease. So I think this is imperative. No, this is a point that we can discuss. We will coordinate with other stakeholders in managing this pandemic. I think those are my thoughts. Thank you and good afternoon.
Okay. Thank you, Dr. Jobel. I think we have the 3 reactors still, two reactors for this afternoon. And of course, we have with us still our two panelists or our lecturers for this afternoon. We have a lot of questions for you guys, no? So, kasi one, as was mentioned in one of the meetings with the city, but parang national, it's 5% ang threshold. And then Davao City is something like 16%. No, sa incidence of COVID patients. No? And then, eto na, lumabas. Ang second data is 1.8 ang sa national for yung mortalities. And then here sa Davao, it's about 5%. And pag naman sana tayong dumating na sabi nga ang forecasting nila is meron palang ganun no, na ang mortality rate is going to be something like 5% or more, and then they're looking at a 100 plus deaths in the city. So I do hope we're not going to reach that. It needs a lot of prayers and cooperation for all the Davaoenos, not only from the Davao City Chamber of Commerce, but the public, the health sector, and everyone to work together. So for this afternoon, can I request everyone to turn on your video, no, if possible, okay? So we have a lot of questions here, okay? And sana yun. So ang pinaka-interesting na maraming questions yata kay Dr. Homer Lim. No, so we have the following questions. So I'm just going to direct whether it's going to be for Dr. Julinda, Dr. Homer, or the rest can, butt in, and so that we'll have a more proactive and lively discussion on how to tackle the Davao situation. We were informed that after this, there's going to be a private and public doctors meeting and together with the RITF, DOH, to tackle the situation in Davao. Okay, for Dr. Lim, the question here goes, is there a clinical evidence of mortality reduction or reduction in progression of the disease in this regimen you are proposing? That's question number 1.
Can I answer
and
that?
then, since you have mentioned about a 63% reduction in mortality, can you please cite also the study that backed that up? Yun po.
Okay, so the numbers I quoted were from the meta-analysis done by a group of PhD researchers. No? So the website is called C19study.com. C Charlie 19, number 1, number 9, and then study.com. So all the papers on hydroxychloroquine, ivermectin, remdesivir, the zinc, so all the positive, negative studies are all there. You can go and see that, and it's all all published. So it's there. You just need to look at it. No? So I did not make that number up. So it's based on the compilation of the studies done by that particular website.
Okay, thank you, Dr. Lim. Here's a follow-up. Is there any part in the country now that is using the prophylaxis? Where and for how long now?
Yeah, so that's Bacolod, no? I know that if you saw the slide I showed earlier, the one with 3 packs, so that's what they're doing now in Bacolod. There's a group now, a business group in Bacolod giving this to their employees, no, to avoid them from getting infected.
Okay. Thank you, Dr. Lim. For Dr. Jelinda, there is a question. Can we qualify COVID-19 as a foodborne disease? Sa pagkain daw po.
No, it's not. It's not a foodborne, but we can have symptoms of diarrhea kasi pwede naman natin makain yung virus. Kaya nga, kailangan natin ng frequent hand washing. Pero hindi po siya identified as foodborne.
Can I add something to that?
Okay.
Yes, even though it's not foodborne, we have to understand that a lot of the outbreaks happen in the wet market. So it's very important for us to realize that it's not foodborne, but for some reason, those wet market places seems to have where they start getting clusters of infection. So it's very important for your wet markets to make sure that people going in and out are sanitized properly. So it's better if you could do misting, as what I mentioned yesterday. You can use hydrogen peroxide 10% solution and then mist everybody going in, going out to avoid spreading the COVID infection. So that's, I think, we have to point out.
Okay, thank you for that, Dr. Jelinda and Dr. Lim. Another question is, we understand that Davao City COVID cases have continued to rise. Thus, we would like to ask, at what point do we see that Davao City will be up again for another lockdown, whether full or granular approach? And what will be the triggers? Dr. Jelinda, sa iyo yata ito.
Okay, for now kasi, we don't, the IATF or the COVID task force in Davao, parang hindi pa sila nagko-consider ng lockdown. Although we have increasing cases, but at this point in time, para pong kaya po namin i-manage with all the interventions and all with the mitigating measures that we are doing. Hopefully, hindi tayo ma-lockdown dahil we also have to consider the other factors, no? Other, sabihin natin, like for example, business, we don't have to close down business kasi nga natamaan na tayo. And then ngayon, pag i-lockdown pa natin daw city, kawawa na talaga tayo. But we are entertaining for zonal lockdown po. Kung saan yung maraming cases sa isang zone, iyon po lang ang ila-lockdown namin. So that was the plan po. Zonal lockdown, possible zonal lockdown. Or sabihin natin na, for example, in a containment plan kasi, pag itong area na ito, itong barangay na ito, maraming cases and the neighboring barangays, sila lang po yung ila-lockdown.
Okay, thank you, Dr. Jelinda. So there's another follow-up question. How is the contact tracing doing? Does it need improvement or anything that needs to be improved?
Actually, for the contact tracing, the DILG has hired 1,500. And we just finished the 2 batches of contact tracers who applied for that position. And this Monday, we'll have another training for the last batch. Actually, kaya nga medyo may kakulangan kami sa manpower sa contact tracers dahil initially, the contact tracers of Davao City were only 30 or less. Kukunti lang talaga kami. At dahil dumadami yung kaso ng Davao City, the DILG really acted on that by employing 1,500 contact tracers for Davao City. And some of those who were already trained 2 days ago were already deployed in the different districts. So makatulong po sila.
Okay.
Marami na po tayong contact tracers.
Is the contact tracing, di ba yung pwede masali dun sa QR? Yan na ba yun?
Yes, the QR code is part of our contact tracing. Kasi pag na-identify kami na close contact kayo through the QR code, pwede namin sila matitrace. So that's part of, the QR code is part of our contact tracing system.
Okay, this is going to be very interesting, the next set of questions, okay? And this will be addressed to all of you, whether reactor or the lecturer, no? Okay, one is, Kasi nga sinasabing gano'n na we have this window of opportunity, which is supposedly the early intervention, no? And we know that 90% of cases are mild or asymptomatic. We have varied approaches kasi. China is isolation. Sa other countries, they don't isolate. But based on what was discussed this afternoon, ang napag-usapan nga is treat the patient, treat the household, and if possible, treat the barangay, the purok and the barangay. So parang the whole, no? Whether it be giving vitamin supplements and if needed for mild or symptomatic patients, no, you have to give the other mode of treatment. So ang tanong lang is, are we open to early intervention modalities? And of course, are we really open to having this COVID positive, mild or asymptomatic removed from their household and placed in a quarantine facility? Is it the best, or we just have this mild and asymptomatic in their houses, monitored, and then, you know, give the necessary support? Tapos the whole household will be given supplementation and possibly the purok. I know this is a tall order, but I just like to ask from you, what are your thoughts on this? Dr. Julinda, Dr. Homer, Dr. Jo Beltran, and Christine. Okay, that's how it goes. Thank
Can
you.
I answer first? Okay. So for Davao City kasi, we previously do isolation. Talagang pag merong case, ina-isolate talaga namin. Initially nire-refer namin even, tama yung sabi ni Dr. Homer, even the asymptomatics, yung walang simptomas, nire-refer namin sa SPMC. But because of ang SPMC is very congested na, so the local government decided that we have to have our own PTMF or facility for asymptomatics and for mild symptoms para hindi po namin mako-congest ang SPMC. Now, as to what the Dr. Lim said kanina, actually I was not able to attend yung scientific meeting Malu, but during our meeting with COVID task force na nandun si Mayor, na-brought up yun ni Dr. Kulas, yung lecture
yeah.
Yes, oo. Sabi nga ni Dr. Kulas, Mayor, kasi based on the study lagi daw na kung pwede tayo maka-purchase for ascorbic acid and zinc for our health workers. That's for the health workers. So sabi nga, and the answer of the mayor was very positive. Sabi nga niya, sige Doc, anong brand ang gagamitin natin? Saan tayo makabili niya so that we can purchase that for our health workers? But hearing the lecture of Dr. Lim, a little bit, I'm convinced na kailangan talaga, especially for those asymptomatic na nandyan sa aming facility, then perhaps we can provide them with yung sinabi na mga vitamins, ascorbic acid, vitamin D, vitamin zinc, and also even for the mild asymptomatics. Kasi nga, in other areas like in USA, they don't refer mild symptomatics to hospital. Nandyan lang sa bahay and just monitor the signs and symptoms daily. So, but there are also situations here na minsan ang bahay nila, we have to look also the social and economic status na isang bahay na walang kwarto, yung, lalo na sa mga informal settlers, kawawa sila. So we have to pull them out from the household and put them in our isolation facility. But there are also yung mga VIPs na sabihin natin mayayaman where they can provide their own room with CR na really they can isolate that. And sometimes, minsan pinapayagan na rin namin as long as ma-ensure talaga that they can strictly do home isolation in their houses. In addressing the problem at SPMC po, kung okay lang sana kay Dr. Lim, na kung pwede yung mga mild symptomatics, na ilalagay na lang sana namin sa aming PTMF. At first kasi parang takot kami because we are not clinicians actually, we are public health workers. So baka maggrabe sa aming TTMF at baka mamatayan kami sa TTMF. That was our fear, no? But I think we can invite Dr. Homer to give more lights on this sa City Health Office, and we can convince the mayor to put up more TTMF just to decongest the SPMC and other private hospitals para ma-reserve po natin for the moderate to severe cases ang sa hospital.
Thank you, Dr. Jolinda. Yeah, so at least from this series of sessions and talks we have been having, no, something positive came out of it. The frontliners are going to be given these protective supplements already. And then there's also that possibility that mild asymptomatics with proper care will be able to be transferred to another facility instead of them being lumped everyone in SPMC, no? So nako-congest talaga. And we have only limited beds also in SPMC. And those who will be placed in those areas, then probably we can have that regimen that was given, no? And we hope and pray that it's going to work for all, so that we will be able to bring down that 5% projection. Oh my God. Let's go. Okay, Dr. Homer, please, what are your thoughts?
Well, again, I would like to reiterate, no. I mean, as much as possible, we don't want to put people in an isolation or quarantine facility. Why? Number one is you put them into isolation quarantine facility, you're going to need people. You're going to not only need people, you're going to need healthcare workers who are more needed in the hospitals. So as much as possible, if we can avoid them going to isolation or quarantine facility, the better. Number two, if you put them all in the same quarantine facility or isolation facility, what you're going to put there? You have to make sure that it has what we call negative pressure. Negative pressure meaning the air is more, kumbaga, the air is being sucked out of the place because we don't want the air to be recirculating, which we can cause more, kumbaga, more infection. They can get infected, they can get worse. So if they are mild and they are asymptomatic, let them stay home, do the treatment at home, let the barangay people manage them and monitor them, okay? Only when those symptomatic, mild symptomatic, not asymptomatic, only those who are mild symptomatic that cannot be placed in the household, they cannot stay because nobody will be monitoring them, or for some reason they cannot do it, then you put them in a facility. But as much as possible, let's try to put them at home, because when we isolate the whole household. Just think of it this way. If you are positive, what's the chances of everyone in the household also is infected? Very high. So might as well just isolate the whole household. You spend less. You only need to make sure that they are inside the home. You don't need to pay for their food, for their electricity. So that's more, kumbaga, more cost savings for the LGU, so that they can spend it more for the people who really needs it. Remember, we're too much concentrated on COVID. We already forgot people who are dying of hunger. So we also have to think about this. Like now in Manila, we have a calamity. So that's also money. So we have to think of ways how to deal with this. We cannot do these things, kumbaga, parang repeating the same mistakes as what we did in some places. So if we can do the home isolation, I think it's more manageable for everyone. Then less stress yan sa healthcare workers. Kasi my idea really is how to decongest hospitals, how to make sure that the healthcare workers will be protected also, no? Kasi so that's my main point.
Thank you, Dr. Homer. Any comment for Jobel and Ma'am Christine?
Ladies first.
Okay, Doc. I am also open to the idea of Dr. Lim, no, advocating for the home isolation. So just like what Dr. Jolinda have said, so maybe we could also look at the home setting siguro kasi may mga other factors din na yung mga sa squatters lang din nakatira. And then it would help really as health worker yung nasabi ni Ma'am Jolinda, like giving supplements to the frontliners. So it's a great news, no? So it would be boosting our immunity again, no? So I think another also is the psychological impact of isolation. Kung dadalhin natin yung mga staff natin or the people to the isolation facility away from their family and they have only mild symptoms. So may mga na-interview kasi kami ng mga positive cases. So palagi namin tinatawagan kasi they feel depressed, no, being isolated from their family. And when they are already in their family or in their household, so of course, they get to interact every day. So kung nagpa-positive din siya, so yung mga kasamahan niya most likely, they are also close contact with the family. So we might as well do some home isolation. So I would agree with the idea of home isolation. Thank you.
Thank you, Ma'am Christine. Dr. Jobel.
Yes, here's my take. Let us categorize this patient. So, if asymptomatic, do not treat. But if the patient is asymptomatic and elderly, we will treat. If the patient is less than 60 or less than 50, but with comorbidities like hypertension, diabetes, asthma, renal problems, we will treat early because they are very high risk. These are the high risk population. So I think it's logical to treat early than wait for the cytokine storm to occur, which is already irreversible. So this early, we will give intervention, proper intervention. And right now, we already have an option at hand. So we will try. So what's wrong with trying? If it fails, then it fails. If it works, then good enough. We'll duplicate it nationwide if we want. So those are my thoughts. Thank you.
Thank you, Dr. Jobel. Actually, as what was mentioned by Dr. Homer, this is already being done in other countries like Vietnam, no? And ang main issue lang siguro nito, Dr. Homer, is one, the sourcing, no, of the medicines that will be used aside from the vitamin supplements that were mentioned. Kasi I just need to repeat, vitamin D, vitamin C, and zinc, okay? And quercetin.
Quercetin. Yes,
Quercetin is, pwede daw, correct me if I'm wrong, Dr. Homer, yung onions, ano ba yan? Nutribullet ba yan? O ano ba yun? Just get,
Juicing po.
juicing, that's the term, no? Okay, about 15 ml or 1 tablespoonful. 3 times a day ba yan? Hindi ba tayo mga ngamoy Bombay niyan, Doc Homer?
Di automatic po ang social distancing. So you don't have to worry about social distancing.
No, not that.
If you don't want onion, you can if you don't want onion, you can use talbos ng kamote, no? Talbos ng kamote also very high amounts of quercetin. So
Talbos ng kamote.
yeah, so you can use that, no?
But it's 15 ml, so mashed and pressed, and you just get the juice. Is that right?
Yes.
So it doesn't matter how many. Baka maya tuyot na yung onions. So wala talagang juice.
Wala kang majujuice doon. Oo.
Yeah. Okay, so those are simple tips, no? For the quercetin source. No? Kasi quercetin, I think there are some drugstores who sell the quercetin as capsules, no? But it would be best if you get it more natural, more economical, and then available naman siya. So very easy lang talaga. Now this pertains to those who are mild symptomatic that you really need to treat, okay? We all know that some in the medical community are not open to the use of hydroxychloroquine, but you've already mentioned it a while ago. That you can use it 5 days, 400 milligrams a day in the 2 divided doses, di ba? as
Yes.
additional medications for those who are mild symptomatic. And then there was a mention of a more cheaper alternative, which we can use in dito siguro sa mas maraming areas, which is the ivermectin for humans, no? Di ba kasi ang ivermectin, ginagamit din niya ng mga derma for scabies. And
Yes.
the other
For
one,
deworming also. You can
and for
use as a
deworming.
deworming.
Yeah,
Yes.
Dr. Julinda, do we have ivermectin in City Health or the Department of Health?
No, we don't have. We don't use that as deworming agents. We use the albendazole and mebendazole.
Oh, okay.
Kasi pagkaalam ko dyan, ginagamit din yan sa veterinarians.
Yes, the veterinarians use it.
Oo.
Kasi may nagsasabi din kasi based on, tama ba ako Dr. Homer? Based on kilogram body weight, the ivermectin, so about 15 milligrams per tablet kasi yan, no? So parang nagiging prophylactic siya or parang deworming, but actually you're lessening or decreasing the viral load. Is that right, Dr. Homer?
Actually, no, the study on ivermectin, okay? So the study on ivermectin, I mentioned this last night. No? So the dose for ivermectin for prophylaxis is actually 2 doses, 72 hours apart. And they found out that this is effective for 1 month. So that's why this is very economical with regards to prophylaxis. However, for treatment, you give ivermectin up to 3 days, 3 consecutive days. They found out that it's as effective as hydroxychloroquine for the duration of like 5 days. Actually, it depends on how long they're symptomatic. If they're symptomatic, you keep on giving the azithromycin or doxycycline plus hydroxychloroquine. Now, if you're going to use ivermectin, you only need to give it for 3 straight days, and then it's fine.
Okay. Kasi merong nagko-comment din na ginagamit nila yung ivermectin as a nasal spray before going to the COVID units. No? So they protect themselves with a ivermectin nasal spray before going in or going out of the COVID units. But then you've mentioned, Dr. Homer, last night, and the use also of hydrogen peroxide. Can you expound on this to our medical professionals who are here and exposed to the COVID unit?
So we do recommend hydrogen peroxide nebulization. Okay, however, for hydrogen peroxide nebulization, you cannot use the off-the-shelf drugstore grade hydrogen peroxide. You have to use food grade or medical grade hydrogen peroxide. Okay, 3%, and that 3% hydrogen peroxide, you mix it 1 cc of it. You mix it with 3 cc of sterile water or NSS, and you can use that as a form of nebulization. Personally, that's the one I use every night when I come from my clinic, or if I go out and expose to a lot of people. I do hydrogen peroxide nebulization. The only issue with hydrogen peroxide, it kind of gets itchy on the throat, but as you finish the whole 4 meals, it goes away, and it's really safe. There's no such thing as toxicity because it once it gets in contact with the surfaces, it turns to water and oxygen, so there's no resistance to it. Remember, our own white blood cells produce hydrogen peroxide to kill viruses, bacteria, and fungus. So we're just augmenting what our body is actually doing.
Okay, thank you for that, Dr. Homer. For Dr. Julinda, may nagsabi o may nag-comment, ang problema daw ng home isolation is, this is from Mr. Tabihe, no? Kasi medyo pasaway yata yung ibang families who are mild or asymptomatic but positive, no? They sometimes daw, they go into isolation, but then nagpapasaway pa rin, and even if they're asked to do home quarantining, they still go out. So that's another issue. So protocols have to be placed talaga, no, by the city and the government on how to deal with these mild and asymptomatics who are in home quarantine.
I think that's where the barangay health, barangay, the barangay tanod or the barangay community has, the barangay workers has to come in and really help, because we cannot expect the health department to do everything. So I think the barangay has to help with regards to making sure these people are staying inside their home.
Okay, thank you for that, Dr. Homer. So, Dr. Jobel, any comment?
Yes, regarding dun sa vitamins, no, that was intended for frontliners or healthcare workers, I think it should not stop on that na healthcare workers lang or frontliners lang ang bigyan ng vitamins. Dapat yung mga families din na affected ng COVID, bibigyan din sila. Kasi infectious din sila eh. So it should not stop only to the healthcare workers. But I think it's just a first step. Probably later on, yung mga families bibigyan na rin kung may budget.
Yeah. And I
Yeah,
answer that.
Agree.
Yeah, that's the first step actually. And after hearing this lecture, I think we can tell or request the city mayor to include the families, or kasi kahit noon meron na rin kaming ascorbic acid supply but not zinc and vitamin D. But perhaps we can include this in the procurement, itong zinc, vitamin C, that will be available in the different health centers.
Vitamin D also.
D. Pero ang sabi ni, saan kayo tayo mag-procure ng vitamin D?
Ang pinaka-simple daw, Dr. Julinda, is ano yung Dr. Homer? Magpa-araw hanggang sa mamula ka na.
Agree.
Bawal ng exercise ngayon sa labas.
Magpa-araw lang daw hanggang sa mamula. Magagalit ang derma sa atin ito.
Opo.
Dr. Homer, as to yung sinabi mo na talbos ng kamote,
yes.
Kailangan ba yan i-cook or raw? Raw talaga siya or cooked?
Mas of course, we want as much as possible. If you want as much quercetin, then mas maganda kung raw. Of course, not everyone can eat raw. So I would suggest blanch lang. You blanch yung babad lang sa mainit just to remove whatever you want to remove and make it more, kumbaga, mas makakain. Pero you can even cook, wag lang overcook.
Okay. And another thing, Dr. Homer, can we invite you to talk to the different doctors of the City Health Office?
Sure po, no problem po.
Invite kami sa
We would be happy.
To shed light to our doctors, lalo na sa mga doctors assigned in the different district health offices.
Yes. Hopefully, our goal really here is to get out of this situation what we're having. Sadly for Davao, I have to say that it's gonna get worse before it gets better. From the data that I saw, it doesn't look good. So we have to prepare. We have to now is the time we really have to get all of those mild and asymptomatic out of the hospital, put them in a separate area so that you can concentrate on those who really needs to go to the hospital. I think that because I've seen so many. I've treated over 200. And sad to say, 60 to 70% of those I treated had moderate to severe. They could not go to the hospital, so they were stuck doing their home remedy at home. No one died. The only person that died was the only lady that died was because she told me over, I think more than a week already, she was already having difficulty breathing, so I could not help her. But if we catch them early, I tell you, it will be, your doctors in the hospitals will be very, very happy because it will be congested.
Thank you, Dr. Homer. There's a comment here, suggestion pala. Kasi medyo meron na tayong vitamin C, zinc, and then quercetin, and then we need vitamin D. Para makamura, vitamin D, you expose your hands, arms, and legs. 10 a.m. kasi ang the best, 10 a.m. to 3 p.m. So you expose yourself every day for a few minutes. No? So that's the cheapest way to get vitamin D. Kung may araw. Yun lang din kasi laging umuulan-ulan ngayon. Okay? So there's another question that is different, no, from the previous questions that was posted. So this goes for all also. Is antigen rapid test, can this be a good replacement for RT-PCR for traveling past requirements? No symptom patient or asymptomatic. And how about antibody rapid test? Since RT-PCR is quite expensive for those with mild symptoms. Dr. Homer or Dr. Jolinda first?
Actually, we can use the rapid test, especially if PCR test is not available. It is already, although still under study, but it is included in the recent memo ng Department of Health that if RT-PCR is not available, then we can use the rapid antigen test. But those who are symptomatics, and they are RT-PCR negative, they should do PCR test. If symptomatics and antibody test negative, they should still undergo the RT-PCR test.
Thank you, Dr. Jolinda. Dr. Homer, please.
Yeah, well, honestly, if you are asymptomatic, I wouldn't suggest doing the PCR test only if you have symptoms. So I think that would lessen the burden, the financial burden on our public. No, so if you are symptomatic, then do your swab. If you're asymptomatic, you've been traced to be in close contact with a positive, just do isolation so that, I think that's the easier, better, safer, cheaper way of doing it. No, of course, antibody rapid test really is, I would say you do this on a, on a later time, because most of the time early symptomatic patients will not have a positive antibody test. So it's really important either you do the antigen rapid or RT-PCR only if you are symptomatic. If you're asymptomatic, don't jump and do RT-PCR immediately, because there are more people who really needs the swab.
Sorry. Thank you, Dr. Homer and Dr. Jolinda. Okay, so I think we more or less discussed a lot of things already, and it's almost 4:30 in the afternoon, no? Just to give a recap, okay, the things that we were able to discuss is the one, the possible causes of the high incidence of rising incidence of COVID cases in the city, the glaring full capacity or yung ating mga private hospitals and SPMC. Third is also ang daming mild asymptomatics, no? Na more than 90%. And there was also a mention that the most common comorbidity for Davao cases is kidney problems, no? So that's the number one, okay? So we have to watch out. And based on the discussion also this afternoon, pag more than 50 years old but with comorbidities, or even less than 50 years old, but with comorbidities, you have to give the treatment already or the protocol already, no? And the things that we were able to discuss is we were able not to send out the message to the government that we need to work hand in hand, private sector and the government, in addressing the present COVID situation that we have. We have heard from the hospitals on the real situation now. And from the government, we have seen the resources and the efforts they have done also for the city. But in spite of this, it seems that the public is, kumbaga, wala pa talagang, parang, hindi ko na masabi kasi FB live streaming tayo. Okay. Kailangan talaga natin ng public information, no? So, on what the city is doing and what we need to do pa. And based on the discussion also, it's not only the patient that needs to be isolated and given supplements, but it needs to be the whole household and kailangan the whole purok or barangay. So that's where the zonal quarantine, no, might come into play or come into effect. And probably we can do more, no, in terms of augmenting the immune system of the Davaoenos, no? And we do hope and pray that with this collaboration that we are having now, we will be able to make Davao, no, lower its incidence and cases, and we will not have that COVID tracker saying that by November or December this is so and so. We will beat this together, no. So that's the message that we have to give out to our kababayans. And Dr. Homer is from the concerned doctors and citizens of the Philippines. So tayo din, we need to be part so that we need to do our share in controlling this pandemic, no? Or be able to do and share also our information or whatever, no, needs to be shared. So at this point, I'd like to ask from each one of our lecturer and reactors their piece of advice or farewell speech kumbaga to this webinar. Dr. Homer first, because you're in the web na.
Yeah, so thank you guys for listening. I do hope you learned something. It made you aware that there are other possibilities and there are other ways of how to manage this infection. I'm sure there will be more things that will come up that would help us in this fight against this pandemic. We cannot waste our time just waiting for a vaccine, because that will be, I think, still at the end of next year if what they are saying is correct. So let's find ways to to get over these difficult times ahead. Hopefully we'll have a better Christmas for the whole Philippines. Thank you.
Thank you, Dr. Homer. Dr. Julinda.
Okay. First, I would like to thank the Davao City Chamber of Commerce for inviting me to speak here, and also to Davao Medical Society and Dr. Homer, thank you, and to other reactors, maraming salamat po. And to the listening public, I hope na talagang i-follow ninyo, tulungan nyo po ang government. Medyo hirap na po kami mga health workers dito sa Davao City. Please help us by just following the minimum health standards. Yung sabi ko, yung BIDA, wear ng mask, so, hand hygiene, social distancing, at makinig sa tamang impormasyon lang po. Sana magtulungan nyo kami para we can put a stop to this pandemic. Maraming salamat po.
Dr. Jo Beltran.
Ladies first muna. Ma'am Christine.
Ma'am Christine.
Okay, pa, Doc. We have made a lot of sacrifices already for the past 9 months to keep our family and community safe. No, let us continue the fight. We need a lot of collective efforts in curtailing the spread of this COVID-19. And for the public, we must follow the simple health protocols like hand washing, wearing the face mask, face shield, and physical distancing. I myself have been in contact with a lot of COVID positive staff, but I know at the end of the day, I self-assess. And then when I go home to my family, because we have a lot of fears also and concerns, I do physical distancing with my family. I do self-isolation so that I can curtail the spread. No? So it would start from ourselves, actually. So with our effort from the different sectors, this could really spell a difference. We can do it. Thank you, Davao City's Chamber of Commerce, for inviting me here this afternoon. So this is a great opportunity, no, to be with you. Salamat po.
Thank you, Dr. Jobel.
Okay.
Thank you, Ma'am Christine.
Thank you, Davao Chamber, for the invitation. For the information of everyone, marami na pong mga doktor na nalalagas. As of now, may 3 yata na sa ICU. Isa ang critical. So, magtulong-tulong tayo para supuin itong pandemic na ito. Sa ngayon, yung may mga checkpoint tayo, no? Checkpoints tayo sa Karatig probinsya, may mga kabaong doon na nilagay ang task force na parang ganito yung ang nakalagay doon na stay at home if you don't want to go inside. Stay inside. Do not stay outside if you do not want to go inside the kabaong. So part yan ng information dissemination. Dapat siguro sa mga Pinoy gulatan, no? Para susunod sa batas. Kaya final words, mga Dabawenyo, wag pasaway. Thank you.
Okay, thank you everyone. And this is not the first and this is not the first and only seminar or webinar that we're going to have. We will be having more collaborations with the city, the medical society, and other organizations so that we will be able to bring the message across. We need to save lives. We need to protect the frontliners. We need to improve our economy, and we need to go back to a new normal. So with this, we thank the Davao City Chamber of Commerce for supporting this endeavor, and of course to the Department of Tourism for giving us also their video clips, no? And thank you also to the city government of Davao, the City Health Office, SPMC, the Private Hospitals Association of the Philippines, Davao Chapter, the concerned doctors and citizens of the Philippines. Ang representative nila ngayon si Dr. Homer Lim, but they're a big group, no? And of course, Davao Medical Society. We thank everyone for coming over. If you need some assistance, you may call on them anytime. Okay, Bitaw. For the presentations, you can keep in touch also with the Davao City Chamber of Commerce. With this, we end our webinar, and thank you everyone for joining us. A virtual hug to all. Thank you.
Kalyado mong kamay sa hirap ng buhay. Ang dami mong problema na kung pangiti. No'y pikang nga astig. Saan ka man naroroon, huwag kang matatakot sa barilong patalim, sa bakas ng madilim. Sinisip kong dagat, nalibot kong mundo, nasa puso ko pala ang hinahanap kong gulo. Ilang beses na akong muntikang mamatay. Alam ko ang sekreto, kaya't nandito pa at buhay.
Amazing number of Filipinos work in our NHS, helping everybody. So thank you to all the Filipinos doing all this amazing work.
There is only one thing we say to the God of death, not today. Huwag po kayo susuko, bayani po kayong lahat.
Sabi nila may